If you're an A-level PE student, listen up to this if you want to be able to explain the respiratory pump better. So the respiratory pump is a venous return mechanism. So it's one of the mechanisms that helps get more blood back to the heart. And when you're talking about the respiratory pump, you'd want to focus on what's going on during inhalation. So when you inhale or when you breathe in, your rib cage moves up and out, and that increases the volume in this thoracic cavity. But if the volume is larger, it creates a lower pressure within the thoracic cavity. Now, obviously, the lungs are within the thoracic cavity, but so is the heart. And by creating this low pressure in the thoracic cavity, it then just helps to draw in blood to this thoracic cavity region. So that blood is now closer to the heart. But the main things that they'd want you to mention here is that there is a low pressure, that every time you breathe in, there is a low pressure created in the thoracic cavity. And that pressure is lower in the thoracic cavity compared to the outside of the thoracic cavity, which would be the abdominal cavity. So overall, you would just say that every time you breathe in, you create a lower pressure in the thoracic cavity compared to the abdominal cavity, which creates this pressure gradient. And as a result of that pressure gradient, that encourages blood to flow into the thoracic cavity and closer to the heart, which increases venous return.